Today we are going to explain about histology, and this is a presentation by Dr.K. So histology is the microscopic study of tissues, and tissue is a group of similar cells that work together to perform a specific function. Histology is also called microscopic anatomy. There are 50 trillion cells in the human body, which is grouped into 4 categories. They are called the primary tissues. The primary tissues in the body are epithelial tissue, connective tissue, nervous tissue, and muscular tissue. So the study of these tissue is called histology. Histology is also called microscopic anatomy. So we said that there are 4 primary tissue, and all the primary tissue develops from the embryonic tissue or primary germ layers. The human development begins with a fertilized egg, and the fertilized egg divides and organizes into 3 primary germ layers. They are the ectoderm, the endoderm, and the mesoderm. Ectoderm is the outermost layer, and mesoderm is the middle layer, and endoderm is the innermost layer. The ectoderm gives rise to the epidermis, or what we call the skin, and also the nervous system. The endoderm gives rise to mucous membrane lining of the digestive tract and respiratory tract. And the mesoderm, which is the middle layer, gives rise to the muscle, bone, blood, all the things which are not included in the ectoderm and mesoderm are and ectoderm and endoderm are components of the mesoderm. So mesoderm is the middle layer. So first, you must slice the tissues into histological sections. Histological sections can be longitudinal, cross-section, or oblique section. The longitudinal section indicates that the tissue is cut along the long axis of an organ, like cutting a banana from one tip to the other. The cross-section is also called a transverse section, and the tissue is cut perpendicular to the long axis, like cutting a banana into coin shapes. And an oblique section is when you cut the tissue at an angle between the longitudinal and cross section. The next is preparation of the histological specimen. For this, you use a fixative. The histological section are placed in a fixative. The fixative prevents decay and also helps the tissue to be sectioned. Formalin is usually used as a fixative, but these are all used for solid tissues. What about liquid tissue? Liquid tissue such as blood may be prepared as a smear. Next, after fixing the histological section, the tissue is mounted on slides, and then they are stained. Stains bind to different components of the cell, and when you look through the microscope, you can identify the different components of the cells.